Welcome to your deep dive on respiratory conditions.
Yeah.
We've got a ton of research here, a whole bunch of notes covering everything from, a simple cough to some pretty serious stuff
Yeah.
like COPD and even COVID-19. You'd be surprised at some of the things we found. Like, did you know that taking care of your teeth can actually help prevent pneumonia?
Oh, yeah, absolutely.
And there's a lot of interesting information on why smoking is so bad for bronchitis beyond just the obvious.
It's really fascinating, how much we're learning all the time about how these conditions are all connected.
Right.
What might just seem like a straightforward cough
Yeah.
can actually be a sign of something much more complex
Oh, yeah, for sure.
going on in the respiratory system.
Okay, so let's start with something we're probably all familiar with, acute bronchitis.
Yeah.
So what exactly is happening when we get that annoying cough?
Well, it all starts with inflammation of the mucous membranes in your bronchial tubes.
Okay.
So the airways that carry air to your lungs, and this inflammation triggers your body to produce more mucus,
Mm-hmm.
which is designed to kind of trap and expel whatever is irritating the airways.
Okay.
Most of the time, the culprit is a virus that starts in your nose and throat and works its way down.
So it's like your body's own defense mechanism backfiring a bit.
Exactly. The mucus itself isn't the problem.
Okay.
It's the inflammation that's causing it. And the problem is that inflammation can create kind of the perfect environment
Right.
for bacteria to take hold, which leads to a secondary infection on top of the initial virus.
So we're talking about bacteria that are pretty common, right?
Yeah, some of the usual suspects are Streptococcus pneumonia,
Mhm.
Haemophilus influenza, and Mycoplasma pneumonia. And here's something interesting, that these bacteria can be incredibly resilient. So even after the viral infection clears up,
Right.
they can linger in the airways for weeks
Oh.
or even months, making you more susceptible to future infections.
So that explains why some people seem to get bronchitis over and over again.
Exactly.
Now, the research that you gave me mentioned some people are more at risk than others.
Mm-hmm.
So who should be extra careful?
The elderly, infants, and young children are always more vulnerable when it comes to respiratory infections.
Oh.
Their immune systems aren't as robust,
Right.
making it harder to fight off those invaders. Smokers, of course, are at higher risk
Right.
because the smoke itself damages that delicate lining of the airways, making them more susceptible to both viral and bacterial infections.
And what about people with heart or lung disease?
They're also at increased risk. Their bodies are already working overtime just to breathe.
Mm-hmm.
So any additional stress on the respiratory system
Right.
can make them much more susceptible to complications.
It sounds like a domino effect almost.
Yeah.
One thing leads to another, and before you know it, you're dealing with a more serious situation.
Yeah.
So how would you know if it's something more than just a simple cold? What are the signs that things are progressing to bronchitis?
The first thing you'll likely notice is that persistent cough,
Yeah.
which is usually dry at first, but can become productive as your body starts churning out more mucus.
Right.
That mucus might start out thin and clear, but can become thicker and even change color to a greenish yellow, which we call purulent sputum.
Okay.
Basically, that means there are white blood cells in there fighting off infection.
That definitely doesn't sound pleasant. What about other symptoms?
You might experience wheezing, a whistling sound when you breathe, caused by those inflamed and narrowed airways.
Okay.
Shortness of breath can also develop,
Right.
particularly if the infection spreads to the smaller airways in your lungs.
Okay.
And of course, you'll probably feel generally unwell with fatigue, muscle aches, and maybe even a low-grade fever.
It sounds like it can really knock you down.
Okay.
So what can you do if you suspect you might have bronchitis?
The first step is to rest and let your body focus on fighting off the infection.
Okay.
Staying hydrated is also crucial as it helps thin the mucus and makes it easier to cough up.
Okay.
And if you have a fever, over-the-counter medications
Yeah.
like ibuprofen or acetaminophen can help.
But what about those cough suppressants and decongestants that are so readily available? They seem like they would help, right?
That's a common misconception,
Okay.
and it's important to be cautious with those over-the-counter remedies. While cough suppressants might seem like a good idea to quiet that nagging cough,
Right.
they can actually do more harm than good.
Really?
By suppressing the cough, you're preventing your body from expelling the mucus, which can prolong the infection.
So it's better to let your body do its thing even if it's uncomfortable.
Exactly. And decongestants, while they can temporarily relieve a stuffy nose, can also dry out the mucus, making it thicker
Oh.
and harder to clear. They can also have side effects like increased heart rate and difficulty sleeping.
That's something I definitely didn't know. So what about antibiotics? Do they play a role in treating bronchitis?
Antibiotics only work against bacteria, so
Yeah.
they're not effective against viral bronchitis, which is the most common type. However, if your doctor suspects a secondary bacterial infection
Okay.
based on your symptoms or sputum culture, they might prescribe antibiotics. It's important to take the full course as prescribed,
Yeah.
even if you start feeling better before you finish it.
Right. Stopping antibiotics early can lead to antibiotic resistance. There's a
Exactly.
whole other issue we could dive into.
Absolutely, yeah.
But let's stay focused on bronchitis for now. Are there any long-term implications of having bronchitis, or is it something you just recover from and move on?
Most people recover from acute bronchitis without any lasting effects.
Okay.
However, repeated bouts of bronchitis, especially in smokers, can damage the airways over time, contributing to the development of chronic obstructive pulmonary disease, or COPD.
COPD. That's one of the more serious conditions we're going to be talking about today, right?
Yes, and it's a good example of how seemingly minor respiratory issues can have long-term consequences if they're not addressed properly.
So let's shift gears and delve into the complexities of COPD. What exactly does it mean to have obstructive pulmonary disease?
Essentially, it means that the airways are narrowed or blocked, making it difficult to get air in and out of the lungs.
Okay.
This obstruction can be caused by a variety of factors, including inflammation, mucus buildup, and damage to the delicate structures that support the airways.
That sounds pretty scary.
Yeah.
And the sources you gave me mentioned something about noxious particles and gases. What are those, and how do they play a role in COPD?
That's a key point. We often associate COPD with smoking,
Right.
and for good reason, but it's important to remember that any irritant that you breathe in repeatedly
Sick.
can contribute to the development of this disease.
Wow.
We're talking about things like air pollution, dust fumes, and chemicals. Over time, exposure to these irritants triggers chronic inflammation in the airways,
Right.
leading to all those structural changes
Right.
that make breathing so difficult.
So it's not just about the damage from smoke.
Right.
It's about any kind of long-term irritation to those airways. That's a bit unsettling to think about.
It is, and it highlights why protecting our respiratory health is so important. Now, when we talk about COPD, it's actually an umbrella term for two main conditions:
Okay.
emphysema and chronic bronchitis.
Wait, so COPD isn't a single disease? That's confusing.
It is a bit, but think of it this way.
Okay.
Emphysema is like a problem with the air sacs in your lungs. The tiny alveoli where oxygen and carbon dioxide are exchanged, they lose their elasticity and can even be destroyed, making it much harder to get oxygen into your bloodstream.
Okay.
Chronic bronchitis, on the other hand, is primarily about inflammation and mucus buildup in the airways themselves.
Okay, that makes more sense. So you could have one or the other or even both.
Exactly, and the symptoms can vary depending on which condition is dominant. But some common early signs of COPD include that persistent cough we talked about earlier, shortness of breath, especially with activity, wheezing, and a feeling of tightness in the chest.
Those sound a lot like the symptoms of bronchitis. How can you tell the difference?
That's a good question. It can be tricky, especially in the early stages.
Right.
But with COPD, the symptoms tend to be more persistent and progressive, meaning they get worse over time. And unlike acute bronchitis, which often clears up within a few weeks,
Yeah.
COPD is a chronic condition.
So it's something you have to manage for the rest of your life. That sounds pretty daunting.
It can be, but there are a lot of things people can do to slow the progression of the disease and maintain their quality of life.
Like what?
Right.
The information you gave me mentioned a bunch of tests. Are those just to diagnose it, or do they help with treatment too?
Well, diagnosis is the first step. A thorough medical history and physical exam are essential, of course.
Right.
And your doctor might order a chest x-ray to look for signs of lung damage. But the gold standard for diagnosing COPD is a pulmonary function test, or PFT.
What does that involve?
Basically, you blow into a machine called a spirometer,
Right.
which measures how much air you can exhale and how quickly. This helps assess how well your lungs are functioning and the severity of the airflow obstruction.
So it's like a lung capacity test.
Exactly.
Yeah.
And depending on the results, your doctor might also order additional tests like an arterial blood gas analysis,
Okay.
which measures the levels of oxygen and carbon dioxide in your blood.
So once you have all that information, how do you actually treat COPD?
The first line of treatment, and this cannot be overstated, is smoking cessation.
Right.
If you're still smoking, quitting is absolutely essential to slow the progression of the disease.
I know we've already harped on that, but it really is the most important thing, isn't it?
It's the foundation of everything else. Beyond that, there are medications that can help manage the symptoms and improve lung function.
Okay.
Inhalers are commonly used to deliver bronchodilators, which relax the muscles around the airways, making it easier to breathe.
So they're kind of like an asthma inhaler.
Similar, yes. And for people with more severe COPD, inhaled corticosteroids might be prescribed to reduce inflammation in the airways.
Okay.
In some cases, supplemental oxygen might be necessary to maintain adequate blood oxygen levels.
Wow, it sounds like a whole arsenal of treatments.
Yeah.
And what about those complications you mentioned earlier, pulmonary hypertension and cor pulmonale? Those sound pretty serious.
They are. Pulmonary hypertension is high blood pressure in the arteries that supply the lungs.
Okay.
It can develop as a complication of COPD because the damaged lungs have to work harder to get oxygen, putting a strain on the heart.
So it's like a chain reaction.
Right. And cor pulmonale is a condition where the right side of the heart,
Right.
which pumps blood to the lungs, becomes enlarged and weakened due to the increased workload.
That sounds terrifying. Are those conditions reversible?
Unfortunately, no. But they can be managed with medications and lifestyle modifications to slow their progression and improve quality of life.
Right.
And that's why early diagnosis and treatment of COPD are so important.
This has been really informative. It's amazing how interconnected everything is within the respiratory system.
Yeah,
One thing leads to another, and it's easy to see how things can spiral if you're not careful.
absolutely.
In the materials you sent me, I noticed something about pneumonia that surprised me. The link between oral hygiene and lung infections. Can you explain that a bit more?
It might seem strange at first,
Yeah.
but the connection is actually quite straightforward.
Okay.
Think about it. Your mouth is teeming with bacteria, both good and bad.
Right.
And when you have poor oral hygiene, those bacteria can multiply unchecked, increasing the risk of developing gum disease.
Okay, I see where this is going.
Right, and from there, it's a pretty short journey for those bacteria to travel from your mouth to your lungs.
Mm-hmm.
When you inhale, tiny droplets of saliva loaded with those bacteria can make their way down into your respiratory tract.
So even just breathing can introduce those bacteria into your lungs.
Exactly. And if your immune system is weakened or if you have other underlying health conditions, those bacteria can take hold and cause an infection, including pneumonia.
So basically, brushing and flossing isn't just about having a pretty smile, it's about protecting your overall health.
Absolutely. It's a simple but often overlooked aspect of respiratory health. Now, speaking of pneumonia, it's important to understand that it's not a single disease, but rather an inflammatory condition that affects the lungs, and it can be caused by a variety of pathogens.
You're not just talking about bacteria.
Right, pneumonia can be caused by viruses, bacteria, fungi, and even parasites.
Oh, wow.
And the severity can range from mild to life-threatening, depending on the type of pathogen involved, the individual's overall health, and other factors.
That makes sense.
Yeah.
But it also makes it sound pretty complicated. How do doctors even begin to diagnose and treat pneumonia with so many possible causes?
It is complex, but there are some key things doctors look for. First, they'll take a thorough medical history, asking about your symptoms, recent travel, and any underlying health conditions you might have.
Okay.
A physical exam will include listening to your lungs with a stethoscope, checking for signs of fluid buildup or inflammation.
And I imagine blood tests and imaging studies come into play as well.
Absolutely. Blood tests can help identify the presence of infection and inflammation.
Okay.
And a chest x-ray is usually ordered to visualize the lungs, looking for areas of consolidation, which is basically where the air sacs are filled with fluid instead of air.
That sounds pretty uncomfortable and scary, to be honest. What about treatment? Is it as varied as the causes?
It can be. If the pneumonia is caused by a bacteria, antibiotics are the go-to treatment.
Okay.
But if it's viral, antibiotics won't help.
Right.
In those cases, the focus is on supportive care, which might include things like rest fluids, over-the-counter pain relievers to reduce fever, and oxygen therapy if needed.
So it really depends on the underlying cause.
Exactly, and in some cases, hospitalization might be necessary, especially for people with severe pneumonia or those who are at higher risk of complications.
It sounds like pneumonia is definitely not something to take lightly. The research you sent me mentioned several different types of pneumonia too. Can you break those down for me?
Of course. One way to classify pneumonia is by where it's acquired.
Okay.
Community-acquired pneumonia, or CAP, is the most common type, and it occurs in people who haven't been recently hospitalized or in a long-term care facility.
Yeah.
Hospital-acquired pneumonia, or HAP, is a more serious type that develops in people who have been hospitalized for at least 48 hours.
So the setting where you get sick matters. That's interesting.
It does, and the reason is that the types of bacteria that cause pneumonia can vary depending on the environment.
Okay.
For example, streptococcus pneumonia is a common cause of CAP.
Okay.
while Staphylococcus aureus is more likely to cause HAP. And then there's healthcare-associated pneumonia, or HCAP, which occurs in people who have had recent contact with the healthcare system, like those who have been in a nursing home or have received intravenous therapy.
Wow, it's getting more and more complex.
Yeah.
And I remember seeing something about ventilator-associated pneumonia, too. What's that all about?
Ventilator-associated pneumonia, or VAP, is a type of HAP that occurs in people who are on a mechanical ventilator, a machine that helps them breathe.
Okay.
Because the ventilator bypasses the body's natural defenses, it can make it easier for bacteria to enter the lungs.
That makes sense, but it also sounds pretty scary. Are there any other ways to classify pneumonia besides where you get it?
Yes, doctors also classify pneumonia by the pattern of infection in the lungs.
Okay.
Lobar pneumonia affects a whole lobe of the lung, while bronchial pneumonia involves patches of infection scattered throughout both lungs.
Mm.
And then there's aspiration pneumonia, which occurs when you inhale food liquid or vomit into your lungs.
So it's not just about germs getting into your lungs, but also about foreign substances.
Exactly. Aspiration pneumonia is a common complication in people who have difficulty swallowing, like those who have had a stroke or have Parkinson's disease.
This is all really fascinating, but it's a lot to take in.
Yeah.
I'm starting to feel a bit overwhelmed just thinking about all these different types of pneumonia and how serious they can be.
Yeah.
Is there anything else we can talk about before moving on?
Well, one more thing that's worth mentioning is pleurisy.
Okay.
It's a condition that often accompanies pneumonia, but it can also occur on its own.
Okay.
Essentially, it's an inflammation of the pleura, the thin membranes that line the lungs, and the chest cavity.
Okay, so we're talking about inflammation again.
Right, and when the pleura become inflamed, they rub against each other, causing sharp stabbing chest pain that's worse with breathing, coughing, or sneezing.
Ouch, that sounds painful.
It can be quite debilitating. And sometimes fluid can build up in the space between the pleural membranes, a condition called pleural effusion.
Okay.
This fluid buildup can put pressure on the lungs, making it even harder to breathe.
This is kind of like a double whammy.
Exactly, and depending on the cause of the pleurisy, the fluid might be clear, bloody, or even pus-filled.
That's not a mental picture I needed.
Yeah.
How do doctors even diagnose something like that?
Well, a physical exam can reveal that characteristic pleural friction rub a sound like leather rubbing together when listening to the lungs with a stethoscope.
Okay.
And a chest x-ray can show the fluid buildup in the pleural space.
Okay, and I imagine treatment would depend on the underlying cause, right?
Exactly. If it's an infection, antibiotics or antiviral medications might be prescribed. And sometimes a procedure called thoracentesis is needed to remove the fluid from the pleural space.
Thoracentesis, what's that all about?
It's a fairly simple procedure where a needle is inserted through the chest wall into the pleural space to drain the fluid.
Okay.
It can provide relief from the pressure on the lungs and also allow the fluid to be analyzed to determine the cause of the pleurisy.
So it's both diagnostic and therapeutic.
Exactly, and in some cases, a chest tube might be needed if the fluid buildup is severe, or if there's air in the pleural space, a condition called pneumothorax.
Chest tubes sound a lot more intense than thoracentesis. What's the difference?
A chest tube is a larger tube that's inserted through the chest wall and connected to a drainage system.
Okay.
It's used to remove large amounts of fluid or air and to reestablish negative pressure in the pleural space, allowing the lung to re-expand.
Sounds like we're getting into some pretty serious territory here.
Chest tubes are often used in emergency situations, like after a traumatic injury or during surgery.
Wow, there's so much to learn about respiratory conditions. It's amazing how much complexity lies beneath the surface of something as seemingly simple as breathing.
It is, and we've only just scratched the surface.
Well, before we move on to even more complex topics, let's take a quick break.
Okay.
We'll be right back with more insights from your deep dive. Okay, so we've covered a lot of ground, from simple bronchitis to the complexities of pneumonia and even procedures like thoracentesis and chest tubes. But there's one big topic we haven't touched on yet: COVID-19.
It's certainly been a game changer in the world of respiratory health, hasn't it? And it's a good example of why staying informed and adaptable is so crucial.
Absolutely. So for those who might need a refresher, can we start with the basics?
Yeah.
What exactly is COVID-19?
COVID-19 is a respiratory illness caused by a virus called SARS-CoV-2. It's a type of coronavirus,
Right.
which is a family of viruses that can cause a range of illnesses, from the common cold to more severe diseases like SARS and MERS.
Right. I remember hearing about those earlier outbreaks. So how is COVID-19 different?
One key difference is its transmissibility. It spreads very easily from person to person, mainly through respiratory droplets produced when an infected person coughs, sneezes, or even talks.
That explains why masking and social distancing became so important.
Exactly. And another key factor is the wide range of symptoms it can cause,
Right.
from mild cold-like symptoms to severe respiratory distress and even multi-organ failure.
I remember all those early reports about loss of taste and smell that seemed so strange at the time.
It was certainly a unique symptom that helped to distinguish COVID-19 from other respiratory illnesses.
Yeah.
But we also saw a lot of the classic symptoms like fever, cough, shortness of breath, fatigue, muscle aches, and sore throat.
And the severity could vary so much, right? Some people were barely affected, while others ended up in the hospital struggling to breathe.
That's one of the most challenging aspects of COVID-19. It can be unpredictable.
Yeah.
And certain individuals, like those with underlying health conditions or weakened immune systems, are at higher risk of developing severe illness.
The information you sent me also mentioned long COVID. What's that all about?
Long COVID, or post-COVID-19 syndrome, is a condition where people experience lingering symptoms for weeks, months, or even years after the initial infection.
Wow.
These symptoms can be incredibly diverse, ranging from fatigue and brain fog to difficulty breathing and chest pain.
It sounds like a real mystery. Do we know what causes long COVID?
Research is ongoing, but there's no single answer yet. It likely involves a combination of factors, including persistent inflammation damage to organs and autoimmune responses.
So it's like the virus leaves its mark even after the initial infection is cleared.
In a way, yes, and it highlights the importance of taking COVID-19 seriously, even if you think you're young and healthy.
Speaking of taking it seriously, what about treatment? Have we made any progress on that front?
We have, in the early days, treatment options were limited, mainly supportive care and oxygen therapy for those with severe respiratory distress.
Right.
But now we have antiviral medications that can help reduce the severity and duration of the illness, especially if they're given early in the course of the infection.
And of course, we now have vaccines, which have been a game changer in terms of preventing severe illness, hospitalization, and death.
Absolutely. Vaccines are one of the most powerful tools we have in our arsenal to combat infectious diseases. And the COVID-19 vaccines have been remarkably effective.
It's incredible how quickly those vaccines were developed. It really speaks to the power of scientific innovation.
It does, and it underscores the importance of investing in research and development for new vaccines and treatments, not just for COVID-19, but for other emerging infectious diseases as well.
That's a great point. We can't just wait for the next pandemic to hit before we start working on solutions.
Exactly. We need to be proactive and invest in preparedness, both in terms of scientific advancements and public health infrastructure.
So it's not just about finding cures, but about building a more resilient system.
Right, and that includes things like strengthening surveillance systems to detect outbreaks early years, improving access to healthcare, and educating the public about the importance of preventive measures like vaccination and good hygiene practices.
This deep dive has really opened my eyes to the interconnectedness of respiratory health, not just within our own bodies, but on a global scale.
It is a complex and ever-evolving field, and we've covered a lot of ground today, but if there's one takeaway I hope you'll remember, it's this. Knowledge is power.
That's a great way to sum it up. The more we understand about respiratory health, the better equipped we are to protect ourselves, our loved ones, and our communities.
Absolutely. And it's not just about memorizing facts and figures. It's about being curious, asking questions, and staying informed.
This has been an incredible journey, and I want to thank you for being such a knowledgeable and insightful guide.
It's been my pleasure.
And to our listeners, thank you for joining us on this deep dive into the world of respiratory conditions. We hope you've learned something new and feel empowered to take charge of your respiratory health. Remember, every breath counts.